Hello, everybody. Welcome back. I'm Dr. John Oldham, Chief of Staff at the Menninger Clinic, and we're glad to have you visit us again on our series of podcasts that we call Menninger Mindscape. We have a really interesting guest today, Dr. Nancy Rappaport. Welcome, Dr. Rappaport.
Pleasure to be here.
Or I'll probably say Nancy during this. That's probably easier.
Please do.
You give me the John. Dr. Rappaport is here along with a number of other wonderful guests to participate in an all-day symposium that Menninger Clinic is sponsoring tomorrow along with the Baylor Psychiatry Department. And it's named The Problem of Suicide, which is an enormously important topic. So we're delighted to have Dr. Rappaport with us just for a few minutes to talk a little bit about some of the things that she's going to be telling us more about tomorrow. It would take a long time to go over everything Dr. Rappaport has done, and we don't have that time. So let me just give you a word or two. She is Associate Professor of Psychiatry at Harvard Medical School. And as a psychiatrist and a child psychiatrist, she has been very interested in education, in children, in development, and has worked extensively in the Cambridge public school system with adolescents and children for many, many years. One of the things that Dr. Rappaport has done is written the most interesting and moving book about the loss of her mother by suicide when she was 4 years old. And that book is entitled In Her Wake, A Child Psychiatrist Explores the Mystery of Her Mother's Suicide. That was published in 2009 and actually won the Boston Authors Club Julia Howe Prize, I believe that's right. Which was a very nice recognition. Dr. Rappaport has won many other awards as well, and I'll only mention one other, which was the Cambridge Health Alliance Art of Healing Award, and that award was received just last year. So we're really delighted to have you here with us today, and tomorrow Dr. Rappaport will be telling us in more detail about many of the experiences she's had and her thoughts and feelings about the subject of suicide, which is the theme of tomorrow's conference. So let's hear a bit about what you have to say today.
The biggest part that I would say is that we all can have setbacks and we can have losses or struggles, and how we make sense of that is what allows us to move forward.
And the loss you experienced was, I'm sure, what's the best word? Formative.
Yes, I mean, it's formative, and for me, the way I wanted to make sense of it is that sometimes I think that my mother gave me a gift from the grave because I always wanted to be a writer, and I spent a lot of time trying to make sense of her loss and try to empower myself to then be able to mobilize as a mother and as a child psychiatrist. And when I work with students, and one of the things I wanted to build on what you said is I always work with children trying to find what part of them is the strength that we want to nurture and heal. And that's why I've spent the predominant part of my life in schools, because schools are a healthy environment, and if a child gets derailed in school, they have repetitive failures. And if you can get in there and turn that around, it can allow them to mobilize. So
Well, that's just so interesting. In essence, the word in my mind when you were describing how you have sort of metabolized the traumatic event in your own life is one that relates to resilience and a capacity to really benefit, even though it's certainly not even close to what you would want to have happened. But understand it, get beyond it, and then help others who have similar or other kinds of trauma.
And that's the role all of us as adults taking care of children have, whether we're a parent that has a child that may be struggling with mental illness, or we've had some unforeseen loss in our child's life, or a child has struggles with a learning disorder. It's how do you bring a sense of hope and a sense of promise about how that person is. And there are times, and I've certainly seen it in the work I've done with schools and parents, that there can be a sense that you're not clear how to navigate the future. And that, one of the things I would say that has embodied the way I approach work is that we hold on to hope and that we look for small successes. So even in my growing up, I would say that what allowed me to move through my mother's suicide was having certainly a loving father, having brothers, a lot of brothers and sisters. I grew up in a huge family, of a melded multiple marriage family, and having teachers that were invested in cultivating my mind, and that was huge.
Well, that was lucky, because you had a family of caretakers and caregivers.
Yeah.
Not always is the case with some children, and it's really harder when they're really pretty isolated. You said, I think earlier, that you have children. So you wrote this book about your mother. How old are your children?
Well, I started to write the memoir when I first had my first daughter, and who's now 23. And I wrote it because of the enormity of the loss of wanting to have a mother to share this beautiful granddaughter and not having my mother be there. And so I would write dear letters to, it would be letters to Mama. And it was really just a private kind of being upset with her. And then someone read it and said, you know, these are pretty compelling. And but I didn't have hardly anything of my mother's when I was growing up. Mm-hmm. And that, again, I think when there's tragic loss, particularly when it's complicated, sometimes your other people in the family don't really know how to talk with you about it. So I was enormously lucky, because as I was writing this, there was a trunk of my mother's possessions, and that had been around, that her best friend had kept. And so after my second child, I had access to this trunk, which had a novel that my mother was writing at the time of her death. So that meant that that the memoir really became a back and forth between the two of us, and a rediscovery of who she was as an adult. So some of the ways I always think about when I work with children is that when bad things happen, it's not always so much about what happens to you, but how you make sense of it that builds your resiliency.
Right. And I was just thinking, and we could talk on, but we're probably going to have to wrap up in a minute, because we just have a little bit of time.
Sure.
But what you did was enabled your children to become acquainted with their grandmother through the dialogue that you discovered and also were having.
Well, my kids have different ideas about whether they want to read the memoir or not.
Oh, really?
But I think there's a concept, you're probably familiar with, Ghosts in the Nursery, and the idea that who you have as a parent impacts how you feel towards your children. So I feel like part of my investment was in the natural progression of when your children grow up, there's loss involved. And if you've worked through traumatic loss with your own parent, it then can allow you to be more available to your own kids and be less reactive when they move away from you, which is what inevitably happens, and maintain that closeness.
Sure. And each of them is going through a process, I guess, of sort of knowing the facts, but
it wasn't required reading for my kids.
Okay, okay. But each makes a unique decision about how much to know when.
Yes, exactly.
Okay. Well, listen, we're looking forward to your talk tomorrow. Thank you for spending a few minutes with us today. And we'll hear, I think, some really interesting, new and extensive material as you try to tell us more detail about this.
Well, I'm glad to have made the trip from Boston to be with you.
Good. Thanks for joining us. And thank you for joining us. And we're delighted that we were able to have Dr. Rappaport with us today. And we'll see you next time.